In 1947, the United States Public Health Service established rapid treatment centers across the country to distribute penicillin for syphilis. Penicillin worked. It was cheap. It was widely available. The disease that had killed and blinded and driven men insane for centuries could now be cured with a single course of injections. That same year, in Macon County, Alabama, 399 men with syphilis continued to receive aspirin, not because penicillin was unavailable, not because the doctors didn't know it worked, because the men in Macon County were part of a study, and the study required that they remain untreated. And the study had been running since 1932, and the people running it had decided that stopping it, even now, even with a cure sitting in clinics across the country, was not something they were willing to do. So the aspirin continued, and the men continued to die, and the papers continued to be published. This is not a story about what happened. Most people know what happened. This is a story about how it kept happening. For 40 years, in plain sight, with the full knowledge of the American medical establishment, and with the active cooperation of every institution that should have stopped it. That is the part nobody fully explains. The study began in 1932. The United States was in the depths of the Great Depression. The Public Health Service had been running a program to document and treat syphilis in rural black communities across the South. The program was working. Then the funding collapsed. Dr. Taliaferro Clark, director of the PHS Venereal Disease Division, looked at the situation and saw something else. Macon County, Alabama had a population where syphilis was widespread and largely untreated. The men were poor sharecroppers. Most had never seen a doctor. They had no money, no resources, no political connections, and they were already sick. Clark wrote that the county offered what he called an unparalleled opportunity for the study of the effects of untreated syphilis. An unparalleled opportunity. That phrase is worth sitting with. 600 men were enrolled, 399 with syphilis, 201 without, as controls. They were told they were being treated for bad blood, a local term that covered everything from fatigue to anemia to syphilis. They were given free meals, free medical exams, and burial insurance. They were not told what disease they had. They were not told they were in a study. They were not told they were being watched instead of treated. The study was designed to last 6 months. It lasted 40 years, not because anyone forgot about it, not because it slipped through bureaucratic cracks. The first clinical report was published in the Journal of the American Medical Association in 1936. Subsequent papers appeared every 4 to 6 years, published in reputable medical journals, distributed to the medical community, reviewed by editors and peer reviewers. The title of a 1964 paper in the Archives of Internal Medicine read, "The Tuskegee Study of Untreated Syphilis, the 30th Year of Observation." 30 years in the title. Published in a major journal, reviewed by physicians who presumably read titles. A 1955 paper on autopsy findings reported that more than 30% of the men had died directly from advanced syphilitic lesions. The men were dying of a disease that had been curable for 8 years. This was documented, published, and distributed to the medical community. Not one physician or scientist published a letter criticizing the ethics of the experiment. In 37 years of publications across 15 papers in respected journals, not one external voice objected in print. That silence is the mechanism. In 1943, something happened that made the silence louder. The draft boards of World War II began processing the men of Macon County. 256 of the infected study participants registered for military service. At induction centers, they were diagnosed with syphilis and ordered to seek treatment before they could serve. The Public Health Service intervened. PHS researchers contacted the draft boards and had the men's names removed from the treatment lists. They then notified local physicians in Macon County with explicit instructions about any study participant who might seek care on his own. The instruction was direct. He's under study and not to be treated. A federal agency used its authority to prevent men from receiving a treatment that the military itself had just prescribed. During a war, while those same men were trying to serve their country, the machinery did not fail. It worked exactly as designed. In 1947, penicillin became the standard treatment for syphilis. The PHS established treatment centers nationwide. The study continued. In 1966, a PHS venereal disease investigator named Peter Buxtun sent a letter to the National Director of the Division of Venereal Diseases. He expressed concerns about the ethics and morality of the study. He had been inside the system long enough to understand what was happening. The CDC, which by this point controlled the study, convened a review committee. The committee included representatives from the American Medical Association and the National Medical Association, which represented black physicians. Both organizations provided what the review described as unequivocal support for the continuation of the study. The committee's conclusion: the study should continue until all subjects had died and been autopsied. Buxton's letter changed nothing. He sent another letter in 1968. Again, nothing changed. In 1972, 6 years after his first letter, Buxton leaked documents to a reporter named Gene Heller at the Associated Press. The story ran in July 1972. Public outrage followed. The study was shut down 4 months later. By then, at least 28 men had died directly of syphilis. More than 100 had died of related complications. At least 40 wives had been infected. 19 children had been born with congenital syphilis. The cure had been available for 25 years. I need to stop here and be honest about something, because the easier version of this story has a clean villain. The easier version says, racist government doctors deliberately killed black men. That is partially true. The racial dimension of this study is not incidental. The researchers operated within a belief system that treated black bodies as biologically different from white bodies, and that assumption shaped every decision they made. The study was explicitly designed to observe black men specifically because researchers believed syphilis behaved differently in black cardiovascular systems than in white ones. A belief with no biological basis, rooted entirely in the racial science of the era. But the mechanism that kept the study running for 40 years was not individual cruelty. Individual cruelty would have been easier to stop. The mechanism was institutional momentum. The accumulated weight of published papers, approved budgets, filed reports, and professional reputations that had become attached to the study's continuation. By 1947, when penicillin became available, the study had been running for 15 years. Stopping it meant acknowledging that 15 years of observation had been conducted on men who could have been cured at any point during those 15 years. Stopping it meant confronting what had been done. Continuing it meant the data could eventually justify the cost. That is not a conspiracy. It is something more ordinary and more disturbing. It is what institutions do when the cost of acknowledging a mistake exceeds the cost of continuing it. Peter Buxton sent his first letter in 1966 and his second in 1968. He was inside the system. He used the official channels. He expressed his concerns to the people with authority to act. Those people reviewed the situation, consulted the relevant medical associations, and decided to continue. The system processed his objection and produced a decision to keep going. Buxton then did something the system had not anticipated. He went outside it. He gave the documents to a journalist, and the mechanism that had kept the study running for 40 years, institutional momentum, professional self-protection, the accumulated weight of published research, could not survive contact with the public. The study ended not because the system corrected itself. It ended because someone removed the information from the system's control. In 1997, President Clinton issued a formal apology. The surviving participants sat in the White House. Clinton acknowledged that what was done was deeply, profoundly, morally wrong. The last known study participant died in January 2004. The last widow receiving benefits from the Tuskegee Health Benefit Program, established after the lawsuit, died in January 2009. 10 children of study participants are still receiving medical benefits today. The question I kept coming back to while researching this was not whether what happened was wrong. That is not a question. The question is, what does it mean that the mechanism worked? The study published its findings openly for 37 years. The titles of the papers described exactly what was happening. The data showed men dying of a curable disease. The medical community received those papers, reviewed them, cited them, and raised no objection. One person, went outside the system, and that is why it stopped. The cure existed in 1947. The study ran until 1972. That is 25 years of a government agency distributing penicillin to the general population while simultaneously ensuring that 399 specific men in one specific county in Alabama could not access it, not in secret, in published, peer-reviewed, widely distributed medical literature. The mechanism that made this possible is still the mechanism that governs medical research today. The institutional review boards created in response to Tuskegee, the informed consent requirements, the ethics committees, all of it exists because of what Peter Buxtun found when he looked closely at what the system was doing in plain sight. The question that nobody answers directly is how many other things are currently being done in plain sight, in published literature, in approved budgets, that will require someone 30 years from now to go outside the system to stop. The 399 men in Macon County didn't know they were in a study. They thought the government had sent doctors to help them. They went to the appointments. They gave blood. They trusted the institution. They trusted it for 40 years.